Deeper into who exactly is getting the COVID-19 vaccine here in Kern County. Let's take an in-depth look at the most recent numbers. According to the state's website, as of last week, like Bain just mentioned, vaccination rates among our American Indian and Alaska Native population extremely low, with only 0.4% having gotten shots. The Black community also extremely low, with 3%. Now, the one causing some confusion is the Latino community, which has a near 40% vaccination rate, which is actually more than any other race here in Kern County. Now, from the start of the pandemic, officials pointed to vaccine hesitancy with limited access and language barriers amongst that community. So why do they now have the highest percentage? We're going to try to clear up any confusion by speaking live right now with the co-founder of the Latino COVID Task Force, David Torres. Thank you so much for joining us this morning.
Good morning. Thank you.
So you just heard me mention those numbers. Are you surprised now to hear, that 39% of nearly 40% of the Latino community here in Kern County has now gotten a COVID-19 vaccine?
Actually, I'm not. Several months ago, when we started the COVID-19 task force, the idea behind it was to launch, one, an aggressive test procedure, and then secondly, once the vaccine was going to be out, that we would launch as an aggressive vaccination protocol as well. And I think that we've done so. Not only do we work with us alone, but we work with other organizations such as Bakersfield College, Centric Health Foundation. We work with other organizations that are attempting to try to get the word out there. And we're not mutually exclusive to Latinos. We pretty much try to help as many folks as we can. But and perhaps one of the largest amounts of numbers of vaccines that we've distributed so far have been in the farm working community, and that is with our work in conjunction with the United Farm Workers. So we're following our plan, and we still have an aggressive plan to continue distributing vaccinations despite the numbers being a little bit low right now.
Yeah, that was actually my next question. In terms of a plan, are you guys still doing weekly vaccine sites in Delano and other weekly events, or are things going to kind of change a little bit going forward?
Well, it seems as though we're going to have to start working our strategy just a little bit differently, because when the vaccination came out, we were distributing Moderna, Pfizer, as well as the JJs. Obviously, we had that issue come up with the JJs, but now we're back, and the Johnson & Johnson one and done vaccination. However, yes, we are continuing to provide vaccination sites. We're doing pop-up vaccination sites from time to time. We just did a couple of them in East Bakersfield this past week. We are putting up pop-up vaccination sites throughout rural areas of Bakersfield and locally as well. We're trying to hit as many economically disadvantaged areas that we possibly can to ensure that the vaccinations are being distributed equally and effectively.
Now, what about with adolescents? We know that Pfizer is now, the shots could be here as soon as Thursday. Pfizer shots might be able to be given out to those age 12 to 15. Can you speak to a strategy now for those those younger age groups?
We're fortunate in that we have had contact with Governor Newsom's office. We have also had contact with private organizations, and I can't name it right now, but we've been approached by a major corporation who has heard of our work and wants to work with us. And when that particular team comes into fruition, we're going to be able to mass vaccinate as many teens as we possibly can. And now that is going to be allowed by the government, we're going to do what we can to vaccinate these youth as many as we possibly can in as little time as possible. We do have access to vaccinations. That's the number one deal right there, which is quite difficult for a lot of folks to gain vaccinations. And just let me do a shout out really quick with that individual that you spoke to with Native Americans. We would love to work with the Native American community. They are our brothers and sisters. And this is not a situation, again, where we are just exclusively working with the Latino community. We've extended our hand out to the Indian community, to the white population, to the Black population. We're working hand in hand with them as well. So the Native American community, we would love to work with them. But we are doing everything that we possibly can to get the vaccinations in and as quickly as we can.
Yeah, and I mean, hopefully we can, link you guys up and kind of work something out there, because at the end of the day, we all have the same goal, and that is to get as many people vaccinated as possible. Have you heard yet from some of the youth in the community? Is there any hesitancy to get the COVID-19 vaccine, or have they seen their parents get it and, elders in the community, and they're okay with moving forward and getting a dose?
Actually, I have worked, I can't even tell you how many, but I've worked numerous vaccination sites over the weekend. I do have a day job, as you probably know, but I do work vaccination sites on the weekend. And I know that there have been times when the families have brought over their younger children, be they 14, 15, or 16 years old, and wanted to get them vaccinated. However, we knew that that wasn't authorized at that particular time. So a lot of the Latino families that I have met in the past during vaccination sites, they have attempted to get their children vaccinated. So that to me was a good sign. I know that in the very beginning, when we had a lot of vaccines, but we didn't have people, we were skipping over and basically taking as many elderlies as we possibly could, and then just vaccinating as many other individuals there, despite whether or not it was their time, with the exception of juveniles. But now that we can do that, we're going to wholly expand that, and we're going to try to engage in creative and different ways to attract these individuals, to get them out there so that we can work with them and vaccinate them as quickly as possible. However, I have not seen any hesitancy in the Latino community for that. I have talked to my brothers and sisters from the Black community. They have had some situations there because of historical reasons, but that's going to be quite a challenge getting those folks out there to vaccinate. But again, we're going to do whatever we can to get as many people, including the youth, vaccinated in this county. That is our endeavor and our task.
It's such an important mission. That's all the time we have this morning, but thank you so much for everything you're doing, and thanks for joining us this morning.
And thank you. And I really enjoyed that segment with the Native American population. I really hope they get a hold of us, because we would like to help them out and work with them in vaccinating their community as well. Thank you very much.
Yeah, well, we will make sure to pass along that message for you.